Nose bleeding. What is nose bleeding? A nosebleed is the blood coming from your nose. It is typically loss of blood from the tissue that lines the inside of your nose. Nosebleed is of two types. An anterior nosebleed happens in the front part of the nose. A posterior nosebleed happens inside of the nose. Symptoms of nosebleed. Bleeding from either or both nostrils. A sensation of flowing liquid at the back of the throat. The urge to swallow frequently. Seeing blood coming out of the nose can be alarming, but most nosebleeds are not serious and can be managed at home. Causes of nosebleed. Fragile blood vessels that bleed easily in warm, dry air or after heavy exercise. Cold, nose infection, sinuses or adenoids. An allergy that causes hay fever or coughing. Injury to nose or face during bumps or falls accident. An object inserted up the nostril. Nose picking. Occasionally a bleeding or clotting problem. Cocaine or other drugs inhaled through the nose. Exposure to chemical fumes or superheated steam. Frequent use of nasal spray or medication. Excessive alcohol intake. Diseases such as leukemia or hemophilia. Diagnosis. If nose bleeding is frequent or heavy, visit the doctor immediately. Diagnose with physical examination of nose. Doctor may suggest additional tests depending on the condition. Blood test, nasal endoscopy, CT scan, X-ray. Treatment. First aid. Stay calm, especially children, as panic or crying increases blood flow. Keep the head straight up. If any object is stuck in the nostril, try and remove the object slowly. Place cold cloth or pack over the person's forehead and neck. Loosen tight clothing around the neck. Apply finger and thumb pressure on the soft part of the nostrils below the bridge of the nose. If nostrils are choked, encourage the person to breathe through mouth. Prevention. If nose goes dry, use humidifier or nose spray. Avoid picking nose. Limit the intake of aspirin. Limit the intake of alcohol. Say no to drugs. Avoid smoking. Don't use cold and allergic medication too often.